reasons why we're talking about hip replacement, similar to a knee replacement, usually that driving force is painful arthritis. And arthritis in the hip, it can act a little bit differently than the knee. Sometimes that arthritis in the hip really isn't as much pain as it is stiffness, or you have trouble just getting your shoe and sock on, getting in and out of a car. But typically pain does end up driving that boat for you to come see us, and we get some x-rays and we'll see wear and tear of that hip joint. My preference is to do a hip replacement through what's called an anterior approach. An anterior approach is a more new technique where we are sparing more muscles and actually going in between muscle planes to get down to the hip joint. We can't just scrape the arthritis out. So what actually we need to do is we cut that ball out and we reshape the socket. When we reshape that socket, we're replacing that socket with a nice healthy metal bowl or cup. On the ball side, we replace that as well by taking that ball out, and we're going to use some type of metal on that ball side, and then that metal ball needs to be held in place by a metal stem that goes inside the femur. And then that ball fits inside that smooth plastic liner, which fits inside that metal cup. It'll move like a hip, and you'll probably notice it moves better than your previous hip with all that arthritis.